Hello, my name is Kelly Colwell, and I'm a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a SCAT5 concussion assessment. Starting with the on-field assessment, it is important to recognize any red flags, kind of signifying that the athlete may have a concussion. These include neck pain or tenderness, double vision, weakness, tingling, or burning in the arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, or increasingly restless, agitated, or combative. The next step in this on-field assessment is whether or not the athletic trainer witnessed it or observed the play on video, and simply circling yes or no, whether the athlete was lying motionless on the playing surface, whether the athlete had balance or gait difficulties, motor, incoordination, stumbling, slow or labored movements, whether the athlete was disoriented or confused or had the inability to respond appropriately to questions, whether the athlete had a blank or vacant look, and whether or not the athlete has facial injury after the head trauma. After observing any of these signs, MATIC questions are asked. So you can ask the athlete questions. I'm going to ask you a few questions. Please listen carefully and give your best effort. First, tell me what happens.
I fell and hit my head.
Okay. Well, what venue are we at today?
Three Oaks Park.
Three Oaks Park. Which half is it now?
The third.
The third. Who scored last in this match?
John.
John. What team did you play last week?
The Vikings.
The Vikings. Did your team win the last game?
Yes.
Yes. So if she was able to answer these questions correctly, that would lean more towards her not having a concussion. If she answered a lot of the questions incorrectly, that would lean more towards her sustaining a concussion. And the next step would be moving on to the Glasgow Coma Scale. So this is assessing her best eye, verbal, and motor responses. And out of these three scores, a higher score is going to lean more towards normal, no concussion, and then a lower score is going to lean more towards the athlete having a concussion. So best eye response, a 1 would be no eye opening, a 2 would be eye opening in response to pain, a 3 would be eye opening to speech, and a 4 would be eyes opening spontaneously. And her eyes are opening spontaneously, so she has a 4. Best verbal response would be no verbal response. A 2 would be incomprehensible sounds, so kind of mumbling. 3 would be inappropriate words, so the athlete kind of just saying words that don't make sense. A 4 would be confused, so the athlete can say words but is confused about what's happening. And then a 5 would be oriented, and she was able to respond to the questions that I asked, so I would say she's pretty well oriented. Motor response, a 1 is no motor response, so absolutely nothing. A 2 is extension to pain, a 3 is abnormal flexion to pain, a 4 is flexion or withdrawal to pain, a 5 is a localization to pain, so the athlete being able to point to where the pain is. And then a 6 is obeys commands. The next step after that is a cervical spine assessment, so essentially asking the athlete if they have neck pain or if their neck is pain-free at rest, so without moving their neck, if they do or do not have pain, yes or no. If there is no neck pain at rest, next there would be assessing the active range of motion, so seeing if the athlete can actively of their neck without any pain. And then, is the limb strength and sensation normal? So basically, no pain. They can get through a full range of motion. And that is the on-field assessment. The off-field assessment starts with the athlete background, what sport they play, what team, what position, recording the date and time of the injury, basically an entire background of the athlete, their name, age, gender, dominant hand, any previous diagnosis of concussion, and their most recent concussion, more of a medical history. Has the athlete ever been hospitalized for a head injury? No. Have you been diagnosed or treated for headache disorders or migraines? No. Have you been diagnosed with a learning disability like dyslexia? No. Have you been diagnosed with ADD or ADHD? No. Have you been diagnosed with depression, anxiety, or any other psychiatric disorders? No. Are you taking any current medications? No. If they are taking any medications, it's important to write them down. And then symptom evaluations. I will have you read this paragraph here.
The athlete should be given the symptoms form and asked to read this instructions paragraph out loud, then complete the symptom scale. For the baseline assessment, the athlete should rate his/her symptoms based on how he/she typically feels, and for the post-injury assessment, the athlete should rate their symptoms at this point in time.
So at this point, you would give the athlete the form, and they would rate a number or a series of symptoms on a scale of 0 to 6, 0 being no, they don't have the symptom, and 6 being like super severe, they need to go to a hospital. Some of these symptoms include a headache, neck pain, blurred vision, balance problems, I don't feel right, difficulty concentrating, drowsiness, and then if applicable, trouble falling asleep. So 2 scores will be summed up at the end of this little survey. One would be the total number of symptoms that the athlete is experiencing. So that will either be 21 if the athlete is not having trouble falling asleep, or it will be 22 or out of 22 if the athlete is having trouble falling asleep. Symptom severity score will be out of 132. And the survey will also ask if the symptoms get worse with physical activity or mental activity, yes or no. And then if the athlete is feeling perfectly normal, what % of normal do they feel? And then if it's not 100%, why they're not feeling 100%. After the symptoms evaluation, cognitive screening comes next. So basically asking a series of questions to kind of check the athlete's orientation and their cognition of orientation. So what month is it?
May.
May. What is the date today?
The 31st.
What is the day of the week?
Friday.
What year is it?
2019.
What time is it right now?
7:40.
Correct. So 1 point for every question that the athlete gets correct, and then no point for whichever one they do not get correct. For a total orientation score out of 5. Immediate memory would be tested next. I'm going to test your memory. I will read you a list of words, and when I'm done, repeat back as many words as you can remember in any order. For trials 2 and 3, I'm going to repeat the same list again, but repeat back as many words as you can remember in any order, even if you said the word before. So I'm going to do 3 trials. Baby, monkey, perfume, sunset, iron.
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 Good. So the athlete will get 1 point for every word that they remember. So every trial is out of 5 points, and there are 3 trials. So the total immediate memory would be out of 15. Ideally, each trial should be given about 5 minutes apart from each other. Next is concentration. So digits backwards. I'm going to read a string of numbers, and when I'm done, you repeat them back to me in reverse order of how I read them for you. For example, if I say 719, you would say 917. 493.
94.
Yes. 629.
926.
3814.
418.
Yes. 3279.
9723.
Yes. 62971.
1726.
That's close. So, essentially, if the athlete is able to do it correctly, you circle yes. If they are not able to do it correctly or report the numbers back in reverse, you would circle no, and then they get 1 point for each set of numbers that they get correct. And next are the months in reverse order. So I would like you to now tell me the months of the year in reverse order, starting with the last month and then going backwards. So you'll say December, November.
So December, November, October, September, August, July, June, May, April, March, February, June.
Yes. And for each month that she gets correct, or if she's able to get all of them correct, she gets a 1. And then neurological screening is next. First question for neurological screening is, can the patient read out loud? And she already read the instruction paragraph, so that is a yes, she's able to read out loud. Does the patient have a full range of pain-free passive cervical spine movement? So testing yes. Without moving your head or neck, can you look side to side and up and down without double vision? Yes. Okay, good. Can you perform the finger-nose coordination test normally? So, extending your arm and touching your nose 5 times. Yes. Do you have any double vision with that dizziness? Can you perform the tandem gait normally? So, which foot is your dominant foot? You're right. So I'll have you stand with your left foot back. Balance.
Oh, that foot back.
Perfect. So she's able to balance very well. If she were unable to stand upright or wobbled, she would receive a no for that test. Which kind of leads into the balance examination, double leg stance, so whether or not she's able to do that correctly. Single leg stance, so on your left foot. She's able to do that very well. Tandem stance, we just did that, she was able to do it very well. And each of those 3 tests would be out of 10, and for a total score of 30. And that is based off of all of those little exams and testings. The athletic trainer will be able to decide if the athlete does or does not have a concussion, and then how to act accordingly after that.